I'm so sorry for the interruption. The camera fell. Oh. But then again, yeah, thank you for staying. So let's continue. Yeah, so like I was saying, as far as it's about you, it's you you are taking care of. You have the right to know who is taking care of you. Imagine your doctor is taking care of you and you don't know the doctor's name. In case you come and need to come and see this doctor, how are you even going to find the doctor? Let me say the rooms, the consulting room has changed. How are you going to locate this doctor? Or maybe you've left, okay, you're on your way going. You remember that, oh, you want to come and ask, maybe you have some other question, you want to come and ask this doctor, you come, he's not in the consulting room, so you go out to go ask one of the workers around, what name are you going to mention if you don't know the doctor's name? Okay, so please, it's very important you know your doctor's name, and everyone involved in your care. Okay, it's important you know, you have the right to know. So unless of course you are not interested in knowing, but if you want to know, no one can tell you I'm not going to mention my name or something. You have the right to know the name. Okay, good. So yeah, so this is applicable to all patients irrespective of whether you are on admission or OPD. You have the right to know who is involved in the care. Okay, good. So 5, the patient has the right to consent or decline to participate in a proposed research study involving him or her after a full explanation has been given. We do a lot of health researches, okay, and we come out with findings, yes, findings that are implemented in policies, for our healthcare. Good. And so we like to use, when it comes to, it depends on, okay, so it depends on whatever the research is about. So let me say the research is going to talk about maybe food that will be good for individuals with hypertension. Okay, this is not a typical research topic, but I mean the research is about foods good for individuals with hypertension. We want to conduct a research on this, and then we come to a patient who has hypertension. We could explain the research there, what the research is involved. Okay, what the research is about. We could explain this to the patient for the patient to understand and decide to be part of the research. But then if during the process, during the explanation, the patient decides that, after all the explanation and everything, I'm not interested to take part, we do not have any choice than to accept that decision. So the long and short is, yes, there may be a research in a health facility. After it has been explained to you, you have the right to say, yes, I want to be part of the research, or no. I hope you get it. So the fact that it's a research and you're a patient doesn't mean you should necessarily be part of the research. It will be helpful if you are part to be able to inform, tomorrow's decision when it comes to even production of certain drugs, certain treatment measures and all of that. It will be helpful. But then you have the right to say yes or no. You want to do or not. Okay. So that is what it's basically about. You have the right to consent or decline to participate. Okay. Good. Basically that. And even about this, it's also added. Okay, so according to the Nyaho Medical Center, it's added that even if you agree to join and during the process of the research, you change your mind and you say you are no longer interested, you can decide to move out of the research. That's according to nyahomedical.com. The seat writes, a patient who declines to participate in, okay, yes, a patient who declines to participate in or withdraws from a research project is entitled to the most effective care available. So if for whatever reason you decide not to participate in the research, it doesn't mean we are not going to treat you the way we should treat you. Okay, so you will still be given treatment. The research is different from the treatment. So the research is a different thing. Okay, so you can decide to participate in the research or not, but you will still be given the necessary treatment. So the 7th writes over here, nyahomedical.com. The patient has the right to privacy during consultation, examination, and treatment. So when you enter the consulting room, okay, you have the right to privacy. You have the right to privacy. Imagine if you enter the consulting room and it's like there are 3 other patients over there. You may not want, so the thing is, you may not want someone else to hear what you have to tell the doctor. You have the right to request for that privacy. In case you enter a place and that isn't so, you have the right to request for that privacy. Okay, so you have the right to privacy. That is why whenever you enter the consulting room, it is you and your doctor. You pour your heart out, you tell the doctor all that is wrong with you, in fact, everything that's wrong with you, and he or she will keep your information confidential. Okay, I hope you understand. So you have the right to privacy. So it is this right to privacy that you have, that the consulting room is such that it is you and the doctor. Okay, and at times there may be a translator. So let me say, if there is a language barrier, okay, if there's a language barrier, and maybe the language you are speaking is something the doctor doesn't understand, then there will be another health worker to explain, to be the translator between the two of you. I hope you get it. Good. So that is it. 8. The patient is entitled to confidentiality of information obtained about him or her, and such information shall not be disclosed to a third party. I hope you get it. Good. So like I said in the other one about the privacy, okay, it's you and the doctor. So you are telling the doctor your information, and then the doctor will help you, will help you, like will help take care of you. Okay, he or she will diagnose you, treat you, based on whatever information you give him or her. And he won't go and tell anyone else your information. Okay, so it is confidential. The information is confidential. Okay, so there are some exceptions to this law, this charter. Okay, so there's been cases where we're giving examples of, let me say, there comes a time, okay, where a court will need this information of yours. Yes, I think Nyawo has it here. Let me just read that. Okay, so let me just read everything here. The patient is entitled to confidentiality of information obtained about him or her, and such information shall not be disclosed to a third party without his or her consent, or the patient entitled to act on his or her behalf, except where such information is required by law or is in the public interest. Sorry, let me take it again. The patient is entitled to the confidentiality of information obtained about him or her, and such information shall not be disclosed to a third party without his or her consent, or the person entitled to act on his or her behalf, except where such information is required by law or is in the public interest. I hope you understand. Good. So the long and short of it is, whatever you tell the doctor stays between you and the doctor. That is the long and short of it. So the exception is an extreme case where maybe you had an issue with court, and court will need that medical information. Okay, but if court doesn't need that medical information, we do not, no one will come and ask for that information for anything. So it is between you and the doctor. If you do not go telling other people about it, whatever you tell the doctor is between you and the doctor. Good. The 9th one is what the patient is entitled to all relevant information regarding policies and regulations of health facility that he or she attends. So if there is any peculiar information that you need to know about which particular health facility you attend, you have the right to know. Okay, like I always say, it is your body. It is you. In fact, Jim Rohn said that we need to take care of our bodies because it's the only place we have to live in. If this body dies, where else are we going to live in? Nowhere. So it is your body. So everything is aimed at you. You have the right to know what you need to know when it comes to your health care. Unless, of course, you say you do not want to know. But you have the right to know. It is something that has to be given to you if you ask for it. Okay, so you have the right to it. So 10, procedures for complaints, disputes, and conflict resolution shall be explained to patients or their accredited representatives. This is explanatory, right? Good. Hospital charges, mode of payments, and all forms of anticipated expenditure shall be explained to the patients prior to treatment. You understand, right? Nyawo has it here. The exemption facilities, if any, shall be made known to the patient. And then the patient is entitled to personal safety and reasonable security of property within the confines of the institution. So as long as you are staying with us, as long as we are treating you, it is your right to have us protect you. That is why if you observe, there are security personnel in every hospital. I'm using every because for every hospital I've attended, there are security personnel. Okay, so if you know of any health facility that there isn't any security personnel, maybe you should let me know. Okay, so from what I have seen, I'm using the every for. Okay, so I think maybe let me say it this way. That is why I have noticed that there is there is security personnel in every health facility that I have visited. I think this month better. Good. Well, yes, that is because it is our right as patients. We are entitled to personal safety and reasonable security of property within the confines of the institution. So when I bring something, so imagine I bring my bag on admission. I have the right to have that bag protected. Okay, so as in that bag should feel safe in that hospital. That bag should be safe in that hospital. So it is my right to feel safe myself in the hospital and for my things to also be safe in the hospital. I hope you get that. Good. So the final right on the yahoo medical.com is what the patient